and welcome to The Art of Being Human. We have been working on drug addiction, and I've been talking a lot about it, different kinds of drugs, alcoholism. I think we only have probably 2 more segments of that, and then I'll be doing something else. But I've spent a long time with it. But the reason I've spent a long time with it is the fact it's such a problem. There are just so many people addicted, especially to pain medications and heroin and alcoholism, that I really wanted to get into it deeply so you could understand the process of it. What happens? What are the side effects? What happens to you if you don't stop drinking? What happens to you if you don't stop taking drugs? And the reason is that just there are too many people that are ill, too many people that have lost their families and lost their jobs and lost their homes because of an addiction, partly because they didn't think they could become addicted because they thought that they would be immune to it somehow. Yes, they were going to drink some. Yes, they were going to use some drugs, but they always returned to feeling normal, so they felt it was safe. And they were lulled into complacency. And then as a result of that, they got dependent, and then their body wanted more, and they couldn't get the good effects and the highs from it without either changing what they were taking or taking more of it. So they went and just did more and more and more, and then they found that their bodies were so hooked that they couldn't get off from it. And they tried to get off from it. It wasn't pleasurable anymore. They didn't want to do it anymore, but by that time, the biochemistry of their brain had changed. The biochemistry of their body had changed. They were tolerant of it, and their body started demanding it. And it is a problem with drugs and alcohol that your body starts to demand it. Now, I'm not saying you can't get off from it, but it's a problem. And my purpose in helping you to understand what it's all about is to help you to understand the dangers of it, what will happen to you if you do get addicted, and what the process of getting off is like, what the withdrawal symptoms are like. And I'm going to continue with that for 1 or 2 more sessions, and then we'll be on to something else. So let's just take a look at the alcohol use disorders. Now, I've gone into a lot of things that happen to you if you are alcoholic, and what I ran into as I was reading was a whole list of the DSM categories and codes of what the disorders are that you get as a result of drinking. So right now, we're focusing here on alcoholism. So if I can have you do a close-up of this chart, don't pay any attention to these numbers on the left. These numbers on the left are all DSM codes. Now, insurance companies use DSM codes all the time, so that if you give a receipt or if you talk to an insurance company, you don't even have to use the name of the disorder or what it is. All you have to do is codify it. Everybody has a DSM. Everybody uses it. Professional people use it. I use it a lot. And all you have to do is look and find out what these codes are. I did run into a situation where I was working with somebody who was working in a school system, and when I filled out the forms for her, she said that they said they couldn't process it without knowing the diagnosis. Now, I know that's a crock, because we don't use a diagnosis. We use the codes for the diagnosis. That way, the person has much more privacy. So I explained to her to tell to the person that was talking to her about it that it's not necessary to have the diagnosis on any slip. We use the codes instead, and that increases the person's privacy. Frankly, I think they just want to know what she had. They process these forms all the time. So let's go back here, and so we're going to ignore these, but I'm going to tell you about alcohol use disorders. First of all, becoming dependent upon alcohol, and then having alcohol abuse. These are the disorders that you can get as a result of use of alcohol. I'm just going to kind of list them off. I'm not going to go into them too deeply because we've talked about them a lot. But this is an entire list that is done by the DSM, so I thought it would be interesting to see it. There's alcohol intoxication that's codified. Alcohol withdrawal, also having a code just for the withdrawal and the withdrawal symptoms. Alcohol intoxication that leads to delirium. We've discussed delirium before. It's when the person it doesn't have any sense. They can't focus on anything. What they say is just delirious. It doesn't make any sense. So they're not thinking right. Then you have alcohol withdrawal that leads to delirium as well. Then you have alcohol-induced persistent dementia. Most people don't know probably that you can get dementia from the use of alcohol. Alcohol-induced persistent amnesic disorder, alcohol-induced psychotic disorder with delusions, alcohol-induced psychotic disorder with hallucinations. The difference between delusions and hallucinations are this. A delusion is when you're thinking about something and it can't possibly be true. It's a belief system that's not true. It's not seeing something. It's not having a hallucination that's auditory, but you can't, the thinking and everything is just completely not right. A delusion would be if a person thought that they were going to get secret information from a man from Mars as to the future of mankind, because it was going to be sent to them through waves which would go through the air into their brains, and they would be the only ones that would have this information. That would be a delusion. It can't possibly be true. The hallucination is when you're either seeing something or you're hearing something and it's not there. When I was a professor at a college I was teaching at, there was one student who had hallucinations. He was a schizophrenic. That's what his diagnosis was. He was a person who came to me and gave me a razor blade. This was my first day of teaching at that college, out of state. And he gave me a razor blade, and I says, why should you give me a razor blade? I'd never even seen him before. This was the first day of classes. And what happened was he said, well, I want you to keep this razor blade because this is what I want you to defend yourself with when I come to kill you. Well, of course, it didn't take much of that kind of behavior to know something was really wrong. And when I had a meeting with him and the dean, we sat in the dean's office. I never went by myself anywhere until he was finally dismissed because he was too dangerous. But he told the dean he was seeing all these golden butterflies crawl up the wall. There were no golden butterflies crawling up the wall. When the meeting was finished, the dean said to me, he's the most unstable boy I've ever seen. And so I explained, this is a psychotic individual. This person is having hallucinations. They're seeing things that are not there. They're hearing things that are not there, auditory and visual hallucinations. But you can get that from alcoholism. So delusions and hallucinations. Alcohol-induced mood disorders. We've discussed mood disorders before, and that there are a whole group of them. Alcohol-induced sexual dysfunction, alcohol-induced sleep disorders, alcohol-related disorders not otherwise specified. When you see the code NOS, that always means not otherwise specified. In other words, the person has a condition that's related to the drinking or the drug use. However, it's not listed as a specific sub-disorder because the symptoms aren't exactly in line with any other disorder. Now I want to get into a little bit more about heroin. Heroin and the use of drugs, and I'm going to talk a little bit about alcoholism too as I do this. Heroin kills more than other drugs. And what addicts want more than anything else is to be left alone to become high. Now, I don't think you realize if you're not involved with drug use, if you don't want to use drugs, if you're not addicted, how lonely that experience can be. It's a very, very lonely experience to be an alcoholic or a drug addict because your whole life now is based upon how to get more and more of the drug, how to live every day, but how to live every day with a supply of drugs on you so you can always take it if you want it, and you're always going to want it. And so your whole life changes. People don't want to be around a person that's addicted because all they do is have the symptoms of being high. And they can become dangerous, and they can believe things that aren't true. We've talked about delusions and hallucinations. It's very difficult to have a relationship with somebody who's so drugged up. that you can't be reasonable with them. You can't have a normal conversation. But they don't necessarily like that either. But the high is very, very intense. And what they want to do is get high. It is just absolutely, and I can't explain exactly what it is because I've never had that kind of experience because I don't use drugs and I don't drink. But they can get so intense, the pleasurable feelings can get so intense that they're willing to lose everything just to get that next high. And so it becomes lonely. If a person is on a drinking binge or using drugs on a binge, they sometimes will just go out and rent a hotel building, a hotel room, and then they'll be in the hotel room and they don't go out, they don't see their friends, they don't use the phone, they don't go out to dinner, they just sit in the hotel room and drink and drink and drink or use drugs from one to the other, to the next drug, to the next drug, to the next drink. And that's what they do until they can't do it anymore because they've run out of money or they've run out of drugs or they run out of alcohol and they just sit there in a solitary place, a hotel room. If they don't have enough money for a hotel room, it may be under a bridge somewhere, it may be out in the woods somewhere, they may be living in a tent, they may be homeless, they go, anywhere they can to be alone and just use the drugs. It's very, very sad when you stop to think of it. So before anyone decides to use a drug because it makes them feel good for a while, they've got to look at the long range of what it's going to lead to because no one is going to be able to resist the drug dependence when it comes. And for some people, it comes almost immediately. Other people can drink or use drugs for a longer period of time, but eventually, when you drink or you use drugs enough, you will become addicted. It's just the name of the game. It will happen because of the chemical nature and biochemical nature of what's going on in the brain. So they want to be left alone so that they can become high, and that's their whole purpose. They have the feeling of being high, as I said before, is so intense that nothing else matters. It's the same for alcoholism as well. The most common emotion is a feeling of isolation, but it's also what's sought out. They don't want to be isolated necessarily. They would like to have friends around, but at the same time, they want to be isolated because they don't want anyone to know how much drinking they're doing or how much drug abuse they're doing. And the only kind of camaraderie they would have is to meet up with other people that are also using drugs and alcohol and stay with them. So they're there doing drugs together. But that's no kind of life. You don't have any kind of a normal life. By this time, a person would have lost their job, they would have lost their houses, they would have lost their friends. I had a close friend of mine through high school, and he became an alcoholic, and all he wanted to do was drink. He eventually did get off, but when we went to a class reunion, he was so obnoxious, he acted so awful that people wanted him to leave. He was almost escorted out of the reunion because he was causing such a problem for people. And just because of his behavior was off the wall. And when we had another reunion after that, our comments were all the same. I hope he doesn't come to this one. We don't want to put up with his behavior. But by that time, he'd married and he had kind of settled down and he wasn't drinking as much. But you see, for a person who starts to drink and they have that problem, it's going to be hard to get off from it. And it's going to be hard to stay off from it because the craving and wanting to get high and wanting to be isolated so you can get high, which you can't do with other people around, is really, really profound, kind of pathetic. So that's the most common emotion, the feeling of isolation, but it's also sought out. There is a 60% rise in deaths from heroin. People get addicted to prescription drugs, and prescription drugs are very, very expensive. So what they do is switch to heroin because it's cheaper. And sometimes if they're dealing with drug dealers on the street, they will deliberately put heroin into medications or whatever they're buying to use, so that they will have another addiction to deal with. It's hard to get off heroin. It kills a lot of people. It's very hard to get off from it. There is a predisposition, a genetic disposition to using the drugs, and sometimes they're used for self-medication. Heroin comes from the opium poppy, and when you use heroin, you get a surge of dopamine. This is what's happening to a person who is using heroin. They get a surge of dopamine, and it gives a sense of euphoria. Euphoria is feeling so good. There's such a sense of well-being that you want to continue to feel that way. It's like everything is wonderful. Life couldn't be better, and you get that kind of euphoria from using heroin, other drugs as well. But it happens because dopamine, which is a neurotransmitter in the human body, floods the system because of the heroin, and it goes into the spinal cord. But it also has some other effects. The breathing decreases. It is possible for a person to stop breathing and die. The pupils will constrict. There'll be pinpoints. They will have a dry mouth. They'll have problems with bowel mobility, infections of heart and lungs. You see, it's a lot of people die. Heroin kills a lot of people. Now, usually you don't die from the withdrawal so much, but you can die from alcohol withdrawal. But the symptoms, you can die if you continue to take heroin because it does kill a lot of people. But the withdrawal itself probably won't kill you. Alcohol withdrawal can. Alcohol just want to get high. And it's the same for heroin users. It takes about 6 to 7 rehab attempts in order to successfully get off drugs. You know, they talk about people going into rehab. They talk about television stars going into rehab. So-and-so's gone into rehab. Then they leave rehab. Then they say, well, they've gone into rehab. This is the 3rd time they've tried rehab. And then they're out of rehab. They don't stick with it because the symptoms are so horrific. They don't stay with it. However, it usually takes about 6 to 7 times of going into rehab, going back into rehab, before a person can successfully go through a program and finally get off the drugs or alcohol. It takes 6 to 7 rehab attempts to do that. And the first few days, of course, are the worst of all. That's when you get a lot of the symptoms. There are medications to help with the symptoms so that you don't have so many symptoms. Now, let's talk about the symptoms of use of the harder drugs: heroin, morphine, codeine, opium, Demerol, Percodan, and also, and there are other types of drugs. Here are the symptoms of the use of those harder drugs: euphoria, lethargy, somnolence, which means sleepiness, apathy, dysphoria, bad judgment. The pupils constrict, the person becomes drowsy, they have slurred speech, constipation, nausea, decreased respiration, they don't breathe that well, and they have low blood pressure. These symptoms, withdrawal symptoms, these are the symptoms of use. The withdrawal symptoms to get off from the harder drugs: they have a craving for the drug that doesn't stop, nausea, vomiting, muscle aches, the pupils dilate, they're sweating, diarrhea, and insomnia. These withdrawal symptoms start 6 to 8 hours after the last use of the drug, and they peak in about 2 to 3 days, and they disappear in about 7 days, around 7 days. It's longer for methadone. If a person is taking methadone, it's a little longer. So those are some of the uses, some of the symptoms of use and withdrawal symptoms. If you're taking sedatives, I haven't gone in too much. I have talked some about sedatives, but not a whole lot. But if you're using them, the symptoms of use: mood lability, in other words, your moods are up and down all the time. poor judgment, slurred speech, incoordination, unsteady gait, attention is impaired, your memory is confused, and you have general confusion. This is with sedatives. You know, if you're taking medication to help you calm down, if you have a lot of anxiety, some of those medications do give some of these symptoms. So you always have to go to your doctor if you're finding that these symptoms, side effects are getting too much for you. They can usually either give you a different dose or a different kind of medication. But some of these drugs do have legitimate medicinal use with a careful monitoring by a physician. The withdrawal symptoms on some of them are going to be nausea, vomiting, malaise, in other words, you just don't feel right, weakness, tachycardia, which is a speedy heartbeat, sweaty, anxiety, irritability, tremor, insomnia, seizures. The withdrawal may progress to delirium in about 1 week after use. And the delirium is hard to deal with. You just can't do anything right. You can't think right. You can't talk right. Nothing makes sense. So I'm going to close it here. We are about out of time. And what I'm going to do next time, which I thought I was going to do this time, but I wanted to finish that up, is that we will be talking about Alcoholics Anonymous and Teen Challenge, how to get help, how they do help, and they do help a lot of people. And I know a lot more people need to go than do, but it is a source of help. So we'll close it here and continue with this next time. Please join me then.